Me Guyana, land of many waters with 6 races living together.
Globespan is a Guyanese dialogue moving towards the realization of one nation in one Guyana. It's a platform that offers an all-inclusive discussion, with the pros, the cons, the ones that is taken aside, and the ones that stand in the middle. Globespan believes agreeing and disagreeing are part of the nation's building. Globespan believes that every Guyanese voice is part of the nation's building. As we span the globe for voices from the diasporas and those living home, we stand on our commitment that we are all Guyanese working towards one nation in one Guyana.
Coffee and Dr. Jagan, Bobby, she gave us our great sons. Rohan Kanhai, Coffee and Dr. Jagan.
As the world turns on its axis bringing changes, we as Guyanese must adapt to those changes for a better Guyana for all. Globespan stands on its axis with its belief that one nation, one Guyana, one destiny must include voices from all corners of Guyana.
Me Guyana, land of many waters with 6 races living together.
Good evening, everyone, and welcome to Globespan Television. Tonight, we're broadcasting live from New York again, as always, and around the world, throughout the Caribbean and around the world. This program is made available by Mr. Noir Singh, and also by our technical directors, Mr. Devin Bissoon and Mr. Ryan Gobin. We'll be having a special topic tonight on mental health. But before I get to that, I want to tell our listeners we can be heard on YouTube and on Facebook. And let me also say, the views and opinions expressed by our guests do not reflect those of the staff and management of Globespan Television. And as you all know, Monday the 12th is Mother's Day. So I'm sending a happy Mother's Day message to all the mothers throughout the Caribbean, Guyana included, and around the world. So tonight I have with us Miss Alicia Solomon, who's a mental health specialist, Mr. Colin Haynes, also who studied mental health issues, and Mr. Craig, Anton Craigwell. He will join us shortly. Welcome to the program, Ms. Alicia Solomon and Mr. Colin Haynes.
It's good to be on the show.
Good night. Thank you for having me.
Ms. Solomon, let me start because Colin was in the program many times before. Can you give us a background of yourself?
One second, sorry. Mr. Craig, if you could rejoin on your laptop, because we're getting a lot of feedback from your end that they don't believe the phone will work. Sorry, Dr. Rose, go ahead.
Okay. Yes, Ms. Solomon.
All right, so a little about me. I am Alicia Solomon, like you've heard, and I've worked in mental health for just over 8 years now. I am also in the capacity of a project manager for the Desert Flower Guyana Inc., which is an NGO that helps to support adolescents who are experiencing mental health issues. So we work with students in school and out of school youths who would have had experienced some form of mental illness and any social issues in general, and just to provide psychosocial support and to provide access to services as well, to ensure that they are being taken care of. So that's basically what I've been doing. I wear other caps, but I do many things, but those are some of the things that I'm doing right now. So yes, thank you for having me as well, Dr. Rose.
Okay. Ms. Solomon, let me start with you. As the topic says, mental health illness is rising in Guyana. Is it? And who is affected most? What age group?
All right, so I don't have any statistics available as it relates to which age group, but I wouldn't. It's not safe to say that it's rising, but because we're having more conversations about mental health, more persons are coming forward. So I don't know what was the data before or what is the data currently, but what I can say is that we're seeing more persons are willing to are open about talking about mental health. They are willing to seek services for mental health, and so because a lot of information is out there about mental health and seeking help and getting help and understanding it's an illness like any other illness, and so more persons are open and willing and are ready to come out and say, I've been suffering with a mental illness and I need help, as opposed to say it is rising. I don't want to say it's rising, but we see more persons coming forward. We see more persons are having the conversation openly. More family members are reaching out for people. More friends in the community are saying, I have a friend who have this, and the person is really ready to have to get help. As it relates to who are affected, so the CDC data would have said that 10 to 15 or 10 to 24, we see persons within that age group are suffering with mental illness. But for me, I would say it depends on the community. It depends on what is happening in that community at the time that you might go in and you see things happening. It also has a lot to do with the political atmosphere at the time. So there's a lot of factors that will say what or who are affected by mental illness in Guyana.
Mr. Haynes, you're a public health specialist and a global public health consultant. It is my understanding that you have traveled around the world as a consultant on public health issues, but I was made to understand that you have done some studies on mental health issues in Guyana and perhaps the Caribbean. Can you tell us some of your findings?
Yeah, Dr. Rose, thank you for having me on the show. So I think it's important for us to put this into context, right? One of the issues is we're starting out with very minimal data, as Alicia is saying. If you look at, for instance, one of the biggest mental health issues in Guyana, which happens to be suicide, we only can acquire data from 2019, which says that Guyana is number 2 in the world. So the countries are Lesotho, which is 72 per 100,000 people. So for every 100,000 people, this is the number of people who are committing suicide, right? Guyana is 40 per every 100,000. So now this means that out of every 100,000 people, 40 people, if you extrapolate this by 7 or 8, which is around Guyana's population between 700,000 and 800,000, you're looking anywhere around 300 people committing suicide. You've got Eswatini, you've got South Korea, Kiribati, Micronesia, Lithuania, they're in the 20s, Russia in the 25, and South Africa 23. I've been to South Africa, I've been to Lesotho, and I've been to Eswatini because South Africa's Lesotho and Eswatini are in South Africa of itself, in the landlock of it. And you can really see some of the issues of suicide, particularly one of the issues in Eswatini. I was told that, and this used to be called Swaziland, right? They changed their name to Eswatini, is that people are not talking about suicide. It's something that is a bit taboo. And in the Guyana context, we're also going to talk about that as well. Now, some of the work I've done as well looked at not only mental illness, but the crossover from mental illness to other disease. So for instance, my master's thesis was examining why patients don't come back to clinic at St. Joseph Mercy Hospital and Davis Memorial in Guyana. So those are 2 private healthcare facilities, one run by the Catholic Church, one run by the Seventh-day Adventists. And they had gotten some money from CDC, or they have a project where they were providing counseling, care, and support for patients who are infected with HIV and AIDS. And so one of the things that we did is we looked at the number of people who have access to support services, and we even made overtures to provide support services, because what you'll see is that when you have a disease, that that propagates mental health as well. All right. So whether it's HIV, TB, anything, people are generally concerned about their physical health, and it takes a toll on their mental health. And so what we were able to do is organize support groups for folks, have them come to these support groups where we would encourage them about taking care of themselves, financial security, and many other things that are underscoring the importance of the disease, but it also tackles the mental health issues. So what I'm seeing here from some of the studies we've done is you've got a country where there is high stigmatism. That stigmatism propagates people not talking about the issue of mental health. You also have a system also that doesn't do well in terms of collecting data statistics and developing the institution of mental health.
Mr. Craigbell, you hearing me?
Yes, I can hear you. Can you guys hear me?
Yeah, we're hearing you loud and clear now. Good night.
Oh, good, good.
I'm here to learn from you all about mental health issues, as well as most of our listeners. Now, Mr. Craigbell, mental health illness is affecting people in every country. I did some research, and it's saying that it's more prevalent than cancer, heart disease, etc., etc. If that is true, why is that true?
I think so. First of all, Dr. Rose, thank you for having me on this program. I know this program has been going for quite a number of years. I know some of the other people who have been on this, hosting it and on it. Alicia, good to see you again. Colin, good to see you too.
My pleasure.
I think one of the things that and Colin began to allude to this in a moment ago, where he started talking about stigma. And one of the things that we have to understand is that, and I know that the World Health Organization, as well as the European Health Commission, have begun talking about looking at mental health from a holistic perspective, because the Western European and American construct surrounding mental health is a singular pathological response. What is bothering you? Let's fix that. And let's see how we can put you in care. And first it was in institutions. Now they're talking about returning people to the community to see if the community can take care of them. So in a sense, when institutions and the Western methods have failed, they're now throwing the people back there, throwing them back to the community for the community to take care of them. And one of the things that I could hear you talking about as you introduced is that for as long as humans have walked the face of the earth, we've always struggled with mental illness. It's always something that we've had among us, but we may not have had the language in which to describe it, to express it, or even to say, well, how do we get treatment? How do we get care? Our ancestors, however, knew how to take care of themselves and each other. It was a communal kind of response to someone who was not doing well. But then Western European and American psychiatry and psychology came along and imposed, with using religion as a tool, imposed that on us. And in its imposition, that created even more shame, even more stigma, and discrimination. Because for many of us, especially in Guyana, in a Guyanese context, it's always better when it's in somebody's family and somebody's house, not ours. Mm-hmm. So we can then look and talk about, you see, is them people down there, is their neighbor, is their son, is their daughter, shout your head. And it's also the language we use that creates that shame. And so I'm glad that we're having this conversation here today in at the beginning of Mental Health Awareness Month, that we can focus on perhaps the culture and how we can begin to break the shame and the stigma surrounding mental illness and reinforce mental health in our communities.
You mentioned something, communal response. Can you explain what those people did at that time when you say communal response to help people with mental health issues?
So, for example, there are numerous recountings, and so even among some of our own people in Guyana, you know, when somebody get bung belly,
Yeah.
okay, and you got do nara.
Stop. What is bung belly? You got to explain to the audience who don't know anything. I don't know about that, but explain to the audience who don't know.
Well, I'm talking to a Guyanese audience, so Guyanese would know what I mean by bung belly. So I understand when perhaps there may be a hardness in the belly, some kind of thing is taking place in your intestines that may cause the belly to feel hard, or the person may not be able to go to the bathroom. They may be constipated. Okay, so there may be a hardness or a feeling of hardness in the abdominal region, or somebody may have what we at the time we may not have known, but we might have called it would have been appendicitis, and we might have said the person got NARA. Okay, so there are things that we would use, you know, to treat NARA. But one of the interesting things about it, when I talk about a communal response, is that there's often one or two people in the community, either male or female, who are versed, who are well familiar with herbs and medicines and various types of treatment methodologies, that they will gather the person and say, let me help take care of you. And there would be community members and family members who would come together and say, let me take you in by me. Come and stay by me for a few days. Come and stay by me for a few nights. Okay? We can make some tea, give you to drink, make sure you get some good sleep, and, you know, make sure you're fed, you're bathed, you're clothed, you're taken care of. And so the community will come around and gather to support and take care of you. That communal response was broken through transshipment, enslavement, and all the ills that came with colonization. And in its place was put a Christianity, a religious belief system that focused on the individual, but not on the communal. Does that make sense?
Yeah, that makes sense. Okay, thanks. Thanks for that explanation. Colin, someone corrected you here. But this question is from Ms. Solomon. I just got the note here that Colin, you said 40 per 1,000. The person said 44 per 1,000.
Mm-hmm.
Okay, so we still have a big problem. I don't think it makes it easier. I think we're still in that ballpark of 300, roughly 300 suicides.
I know. But let me direct this question to Ms. Solomon. Ms. Solomon, if it's 44 per 1,000, that's a lot of people we're looking at here.
44 per 100,000.
Per 100,000, sorry.
Right.
There's a lot of people we're looking at here. What are some of the solutions being adopted in Guyana to help these people?
So, so there's a national suicide action plan. There's a national mental health action plan. There's legislations that are being changed. So up to 2022, we were working with the 1930 ordinance for mental health, and then we had legislation from the 1930s as related to suicide, where we were still charging persons for suicide and referring, technically because the law was there, we were referring to persons who had mental illness as lunatics and stuff like that. But now there's a new legislation, there's a new document in 2000, and there was an action plan that was created from 2015 to 2020, and now we would have adopted that it was put into place and put into action, some of what was recommended was like the creation of the mental health unit and the Ministry of Health, more of, Antoine mentioned, more of us talking about community mental health, training of doctors in primary health care setting to work with persons at the community level to address mental health, because of the stigma, because of the issues of person not wanting to come to the psychiatric clinic or going to the psychiatric hospital because of the stigma. So they were training of doctors to work at the primary health care level. So just like how you go to the clinic for diabetes and you go for any other chronic illness, you could have gone to your primary health care physician in that local health center to access care. We see the opening of a lot of NGOs that address mental health issues, and so persons are creating spaces that people can go to talk about mental health. There's also programs that are created in schools so that children can feel safe and come to those to a counselor, come to somebody to talk about mental illness. And there's also, not looking from the prevention side, we see programs being created, but then also we see at the treatment level, we see persons being able to access service within their regions rather than where it was. We see a lot of decentralization happening where persons are now being sent to various regions. And we're also doing a lot of telemedicine where, as it relates to treatment. So if a physician specialist is not available in a region, they can call and they can do telemedicine and to get services, get help. So there's a lot of things that are being done, but the problem might be is that people are not aware of what is available and how to access some of the services that are available.
Okay, what I'm getting from you is this. There's a stigma towards mental health people or patients. Also, you spoke about suicide, but suicide is an extreme case. When a person commits suicide, this means that they're far gone into the illness of mental, they're helpless. Now, you mentioned a number of programs, and I agreed. I read about some of them. But my question to you is this. Are they working? And if they're working, why do numbers keep on increasing? Colin alluded to the fact that Guyana is the second country with the highest mental health illness in the world. That's what you said, Colin?
Second suicide rate in the world.
Second suicide rate. So why is it that these things are elevating themselves if you're telling us that we have all these solutions in place? So there's a disconnect somewhere. Tell us why.
So it's quite interesting that you asked that question, because as I was preparing to come on the show, that thought crossed my mind. Is like, we have all of these systems in place, but do we know if they're working? And if they're working, how effective are they, right? What I can tell you is that persons are accessing the services, but at the same time, I don't think a lot of people are aware that these services are available and know where to access it. So while there are increasing services, there's still a lack of people being aware of them being available. And I say that because I've had persons who call me personally and say, Miss Alma, where can I get help? I have this situation. Up to last week, I had to personally get somebody to go to an health center, make a call and say, listen, this person is a crisis, they need help. They're out of Georgetown. And I had to do that because the person, they really didn't know where to go. And this person is in the healthcare system and they didn't know where to go. So yes, these services are available, but I think more work needs to be done in the area of making people aware how to access it, where to access it, where they are available, and making it open and letting them know that they can come and access these services and so on. So how effective, I would not be able to speak on that because I don't think there's no amount of data that is available to say, this has worked, this isn't working, so on. So there are some amount of disconnect, but there are a lot of work to be done. And persons, policymakers, stakeholders, we all have to come together to understand that this is not an individual fight, but everybody wants to do something and everybody's doing something on their own. But it's more of us coming together and meeting the needs of the communities and the people that we serve and getting them aware of these services and getting persons to access these services, making them letting them know that, hey, we're here to serve you, we're available, and you can come to us.
Colin, oh, you want to weigh in on that, Colin?
I do.
Go ahead.
I want to weigh in and say I agree to some extent where Alicia is saying that we have more services that we had maybe in the 90s, but it's not working. One of the things, and I find myself in like this jungle trying to explain this to policymakers and to Guyanese in general. So we have partnerships with, and I can outline some of these partnerships we've had with Columbia, Vanderbilt, University of Maryland, Institute of Virology, Johns Hopkins. I know them very well. They're my neighborhood. I live maybe 2 miles away from them. And so much of these institutions, all right? Dr. Oven was going to be on the show. She's part of the New York Department of Psychiatry, which serves as a model institution for mental health in New York City. And New York City, as you know, Dr. Rose, you live there, it's probably the highest mental health cases in the United States of America, if I'm right there. And so there is an institution there in one campus. And it doesn't underscore the fact that there's many other places you can go, many other institutions you can go to within many other health parts of New York City, New York State. So politicians in Guyana, or the political system in Guyana, doesn't really cater to institutions. When I talk about institutions, I'm not talking about the Ministry of Health, and I'm not talking about Georgetown Public Hospital. I'm not even talking about a healthcare center or any hospital. So an institution functions to train and educate people, to have cutting edge research, and to be able to provide quality assurance or data assurance and so forth. Of all the programs we have to ask ourselves, what are they doing in these regards? One major policymaker in Guyana, I remember having conversation with them, tell me, oh, research, we're not there yet. I mean, you're number 2 in the world for suicide, and you don't see the importance of research. That to me is mind-boggling, and that to me underscores one of the issues that we have. So yes, you could say that we have more response now than we did before, but I mean, if at the head of it, we can develop institutions that can take care of people, that can find out where the gaps are for people in mental health, then I can't see us going very far.
Okay, Colin, I have this question for you. And Mr. Craigwell, you can weigh in on this as well. In the United States, 1/3 of the population, and this is the wealthiest country on earth, they keep telling me and telling us, for about 75 million people have mental health issues. Now, but those issues, they said, evolved from emotional, psychological, social well-being, and how people think, feel, and act. Those are some of the causes they link mental health issues here in the United States. Are those the same issues? Mental health issues are the same across borders, or in Guyana and the Caribbean is different, or in the poor countries it's different? Colin.
So generally, the issues are, the cause of suicide is, you've got a number of issues, or let me say in mental health. So you've got a population with depression, you've got a population with anxiety. Now you're the fastest growing economy in the world, and you also have to think that with that comes a great deal of commerce, trade, a great deal of more cars on the street. People are, so anxiety levels, I mean, I travel to Georgetown very often. Anxiety levels are very high in Guyana, but we're not measuring these things, right? We can effectively measure them. So also, are we measuring number of people with depression? I think that we've talked about, somewhere around 40-60%, and that was unofficial data was given, somewhere around that ballpark of people in Guyana suffering with depression. So yes, they transcend, whether you're in Tokyo, Japan, or you're in Berlin, or you're in Georgetown, Guyana. The causes of mental health, or the main aspects of mental health, such as depression, anxiety, ideation of suicide, they don't change. I think what we have to talk about is how can we measure them? How are they being impacted? So a lot of these issues are impacted by what's called social determinants of health. So, many of us, we grow up in a community. So that shapes our healthcare, that shapes our outcome, how many parks we have access to, how many sidewalks, that's important for exercise and well-being. How well we have food security is important. People need to be well nourished. We have an issue of kids going to school a lot in Guyana now that are hungry. That affects their mental health. That affects their ability to concentrate, to learn, to understand. And if you think about a tire that is continually being worn out, then over time it's going to puncture, right? Because now you have the suppression of more economical norms, a greater economy, more pressure on economical norms, housing, security, how many people are actually living in their own homes, living in a safe house. You've got early life issues. You've got some people grow up with abuse, and that's exacerbated by that. Education, how quality is our education? So right now there's all these factors that play in employment. We've got anywhere around 20%, 30% unemployment in Guyana, or underemployment. That's another thing. So you're making money, but you're not making enough money to sustain. And you're saying you are the fastest growing economy in the world, but then you also have to realize that same hand, you have to provide services for a fast growing economy, because you're losing people. Like I said, you go around Georgetown particularly, and you see how chaotic it becomes, and you see how difficult it becomes to live there every day. And people's anxiety levels have to be extremely high now. And so, like I said, it doesn't matter if you live in New York City or Cairo or wherever, these problems still persist. But I think in context of Guyana, it's how do we measure them? Where is the data? How can we effectively measure this to know that there's a problem existing?
Mr. Cragwell, as you know, mental health, as all of you all know, mental health is a disorder. Now, can you explain the economic, the emotional, and psychological impact of it?
So let me take a step back from your question, Dr. Rose, and first offer a correction. Mental health is not a disorder. In mental illness, there are several disorders. When we talk about mental health, it's a progression moving towards mental wellness. Second, I want to just also comment on something that Alicia was talking about, and tie that also with what Colin was talking, that there are the social determinants of health. And within the Guyanese context, we also have to include a cultural component. Mm-hmm. Our culture, the Guyanese culture, similar but different to many other places. Guyanese culture is unique and rich and vibrant, but Guyanese culture is also formed by trauma and pain. Yeah. And Guyanese have not, as a people, being able to adequately get healing from that trauma. And I'm talking the intergenerational trauma that is passed on from generation to generation. As Colin was talking about the social determinants of health and mental health care, which are just as applicable in New York as they are in Guyana, I want to add one more component to this. In February 2001, Craig Anderson published an article that talked about how rising external temperatures contributes to increase in anxiety, anger. And when anger rises, people find ways to either suppress it, which contributes to increased stress and anxiety, or they have violent outbursts that then manifest in forms of violence, whether domestic or other forms of physical violence. But being in an environment where, because of often of colonial era laws and other social and cultural norms, many Guyanese are forced to suppress the way they feel. So you find an increase in alcoholism. You find an increase in the number of people who are using substances, whether it's weed or whether it's other hardcore substances. So how many people would rather, and we know that this is Guyanese culture on Friday evening, instead of you go home with your pay packet that you just get from the week, you go into the rum shop and you drink till 3 o'clock in the morning. And then you crawl in, hoping that your wife don't hear when you open the door. And you go in and she there waiting money there for the market Saturday morning. Oh, me and them boys being at the corner then, and a big row start. And that row now escalates into he hitting her or she hitting him. And there's a big fight, furniture get broke up, that kind of thing. Okay? So, is it possible then that he goes to the rum shop with the boys as a form of escape, as a form of coping, where the alcohol becomes a coping device, where it kind of, to him, takes the edge off of the stress and the trauma he had to deal with in the week? We had Burna Boy had a big concert at the stadium a couple nights ago. How many Guyanese could not afford to buy the ticket, but they went, and next morning, oh no, let me find peace now so I can hold me over till I get paid. Because that also impacts their sense of dignity and self-respect. Because Burna Boy is an escape from the realities that they're dealing with. And one of the things I think both Alicia and Colin are talking about is the realities on the ground that our community members are dealing with. Okay, going to Georgetown Hospital and sitting down in that waiting room on that hard bench in no air conditioner with a fan and waiting for the doctor to tell you, oh, I can't find your file. And you take a day off from work and lose pay for that day off because you're not feeling well. Or you trying to get a minibus on Aubrey Barker Road and the minibus flying past you, the rain falling, and all he can do is splash some water and you'll keep going. And you got on your nice clothes. You trying to make something for yourself. No, you got to go back home and you're late for your appointment. Because all these things have cascading effects. And so what I'm trying to say, what I'm trying to suggest is that if we want to talk about mental illness, it is pervasive. There is documented evidence that it is inherited. So is suicidal ideation and attempts. But there are ways to mitigate it. There are ways to address it. There are ways to provide healthy mechanisms to cope with and to deal with it. Again, coming back to the commune, coming back to the people. So that if I were to see Colin walking on Homestretch Avenue barefoot, a 3/4 pants hanging off his hips, and just a t-shirt, and the sun blazing hot. And he muttering to himself, what do I do? Because Colin is somebody's son. Colin is somebody's father. Colin is somebody's brother, somebody's uncle, cousin. What do I do? Do I keep going? Do I turn and laugh? What do I do to take care of Colin, to help Colin?
Okay. Now, I got a correction here from my good friend in Palm Beach County Hospital. She's a psychologist there, Dr. Carol Blair. People from all over, all the health experts are listening to this because I flash it all over and they're seeing it and they will make comments. She told me that to tell you all that mental health illness is a psychotic disorder. And so my question to you, and this is what she asked me to ask you all, anyone can jump into this. Since it's a psychotic disorder, or early can it be detected in children and young adults? Colin, you want to start?
Yeah, so I want the population to I want us to explain the difference between a disease and a disorder. I think it'll be even greater for us to understand that. So a disease is a medical condition where there's an identifiable cause, right? So in a disease, you can actually see, somebody's got sickle cell, they tend to possess some of the symptoms of sickle cell patients, right? They pass out, things like that. Now, when it comes to disorders, they're equally potent and sometimes even more dangerous than a disease like mental disorders, but you don't see it physically. Someone who is like, and Antoine is saying, walking down the street in Homestretch Avenue with their pants falling off, they self-muttering to themselves, shirt torn or something like that. That is something that is happening internal, in their head and so forth. And so I think setting that definition is important. Dr. Rose, can you restate the question, please?
Yeah, she asked me to ask you, how early can a psychotic disorder be detected in children and in young adults?
Right. So when kids are growing up, right? So we're talking about psychotic. So we're getting deeper into the mind, right? We're getting deeper into ideations. We're getting deeper into their development, how they think. And I think that from a very young age, if you're paying attention, and if you're knowledgeable about this, and for young mothers, I think we should take some time to be able to take a look at this, because I myself are expecting a young kid, and so now this is making me think that as my kid is going to be growing up, you have to pay attention to some of the things that they're saying, how they're reacting to certain things, certain stimuli, whether it's food, light, water, drinks, many different things. So I would say from as young as you can, from when they're born, you can point out and see that certainly now with technology, you have, you can actually test for certain things. So for instance, my wife we did our first set of appointments for a newborn, and they test for Down syndrome, they check for autism and things like that. So you have to be proactive with that. Now, in the context of Guyana, are those services available? Right? They're not. So now, and also, you've got kids as well in Guyana that we've been noting having certain delays, right? Whether it's a speaking delay, understanding delay, these kind of things. Now you also have cases where I've been told this, and it shocked me, and it made me very angry, to be honest, where kids who have delays are being placed in the back of classes. That's just not the way. And I feel like part of our educational system, we have to put an emphasis on special education. You can't put kids in the back of the class if they have delays. Matter of fact, I think you have to put them in front of the class because you need to pay attention to them if they have those. So as they're coming through from newborn to they're going to school, as they're growing up, this is a constant process. And so, Dr. Rose, I don't think that there is an age limit. Matter of fact, like I told you, because we're having this conversation is now is going to actually make me myself be more conscious and more aware of this as I'm expecting my newborn son.
Well, the saying Guyana, the age limit for mental health issues are between 15 and 35. Now, I have a question for all three of you. It's said in some communities in Guyana, this is in Guyana, not any other country, mental health illness are misunderstood or mistakenly in the country because the symptoms are mistakenly attributed to witchcraft, known locally as obia. Who wants to weigh in on this? Alicia?
Yeah, so before the whole conversation, and even now that we're having the conversations about mental health, people still believe that persons who exhibit certain symptoms, in local terms, it's like you get do, all right? And persons will go to their religious leaders, they'll go to the imam, the pandit, whoever they believe can heal them before they come to the healthcare system. And what has happened in the past, we know persons, I can tell you a lot of cases where I've known people who you see them and the family would either lock them away and say, listen, we're not dealing with it, or they take them to places to get help. So it's cultural that we believe.
What places? What places?
So they will go to either the like you said, the obia man, or some persons will go to their religious leader first. So they'll go to their pastor, and the pastor will pray for them and hope that whatever spirit would have come over them will leave, and then they'll go to the imam or the pandit, and they'll do whatever religious practices they practice, and then if it doesn't work, then or it gets worse, then they'll come to the healthcare system. So we've seen that in the past, and it still happens in some communities. Persons prefer to, because they believe it's spiritual as opposed to a health issue. And I think with more education and us talking more about it, people understand that this is not only because of their belief system, it's not only spiritual, but it's a medical condition, and they can get help, they can be better. But yes, people do believe that it is witchcraft, and it takes the necessary step to address it from that angle before they even come to the healthcare system. And some of the pandits and or those religious persons who have the knowledge will tell them, you need to go to the hospital, you need to go and get help. We can't do anything for you. Whereas those who doesn't have the knowledge and they believe that they're the healer, they perform their ceremonies and they do what they have to do to assist that family, and then the person is well for a few days, and then the symptom come back, they go back. So yes, it does happen, but I think with more education and more information, as we continue to do sessions like these and to make people aware, we'll see persons. We've seen persons who would have now started to refer persons and understand that it is a health condition that can get help. You can get help, and help is available. And letting them know where help is available too can also help to address those problems.
I have a message here, and Mr. Craig will ask you to address it. And this person is a Jamaican because he mentioned Jamaica. He said mental health issues in Jamaica are being cured by marijuana, which soothes the nerves. He said it's a nerve problem, and mental health and marijuana soothe the nerves. I don't know if there's any study. I don't know if there's any study towards that effect.
There is.
There is?
Yes.
So Tell our listeners about it, Colin.
Well, well,
Tell our listeners.
well, just a few years ago or so forth, you know, I think Sanjay Gupta did a television show on marijuana because for a long time we've thought that this thing it was, you know, it was this bad drug.
He's the CNN health expert, right?
Yeah, he's a CNN chief medical correspondent. He's a neurosurgeon,
Right.
and so forth. And so, what he was saying was drawing parallels to, and I'm sure you can go and find many studies on this. People who have anxiety, particularly people who have anxiety, when they use marijuana, it's an inhibitor, right? So the cannabis sativa, it actually, what it has part of it, it reduces their anxiety levels. They even show someone who had a speaking disorder, and they were showing literally as he was smoking marijuana how it transferred from his speaking incapability to him actually speaking properly. And there's many studies, and so this is why developed countries now, Europe have you know completely got rid of it as a prohibited drug. It's now commercial use. Many states in the United States, the District of Columbia, the capital of the U.S., it's widely free to use recreational in public. I know sometimes it's very strange because we haven't accustomed to this for almost 20 years. You live in somewhere and you haven't seen that. But yes, marijuana has come out as one of those things. Now there's also the THC that is separated from the marijuana. There's oils that are extracted from it and things of that such. So there are derivatives now that you can use to reduce anxiety and things like that. So yeah, it is something. And I think that what we have to do is we have to do more research or do more studies to be able to look at it, because now everybody just thinks that, you know, this is just something that people are making up, but it's not. It's actually real.
Mr. Craigwell, are you aware of that?
Yes, I'm aware of it, and I'm aware that there have been limited studies to examine the effects of marijuana and THC and the cannabinoid compounds on the brain, particularly on the prefrontal cortex of the brain.
What's THC? What is THC?
Tetrahydrochlorine.
Okay.
I think that's what it is. THC. THC is its active ingredient in marijuana.
Cannabidiol.
Yes.
Cannabinol. Yeah.
Tetrahydrocannabinol.
Mm-hmm.
And it's the active ingredient in marijuana, and there are limited research at the moment to show its effect on the prefrontal cortex for both men and women, in how it transforms and affects mood and behavior, because it's the prefrontal cortex of the brain that actually impacts mood and response and behavior. I just want to go back a little bit again to the conversation that was started about mental illness in communities. And I know that Alicia was talking a moment ago about people going to Obeah and so forth. But to understand that this is what I talked about at the beginning about the communal aspect about dealing with mental illness. The communal aspect where there would be a healer or a shaman or a high priest. And so when our ancestors were brought in enslavement, they brought their practices with them. And just actually in December, I went to a voodoo ceremony, a Haitian voodoo ceremony. And it was interesting to listen to the priestess do her chanting. And as she chanted and worshipped and called on the different orishas or the African gods, the West African gods, she interspersed that with Christian saints, Christian saint names. And so we know that our ancestors adapted to fit in with the current, with their reality. And so one of the things that I wanted to be very, to make very clear is that the Western, European, and American psychoanalytical model, paradigm, construct is not something that Black and people of color easily identify with. It is not something that we know. So Colin was talking earlier and Alicia was talking earlier about people going to therapy, going to seek mental health care. Why would they go to sit down to see a therapist who is spouting language and terminology and diagnoses that they have no understanding about? It does not resonate within them. And so being able to talk with someone, and so like, for example, Alicia may remember back in 22, I was in Guyana and I did 12 mental health awareness workshops from Parika, Essequibo River, all the way up to Adventure in Blackbush Polder. And one of the interesting things that people said throughout each one of those workshops is, why you sound like one of you, but you look foreign? I said, because I am one of you. And they were able to understand when I could lapse into Creole and use idioms and references that they can easily identify. So I talked earlier about Nara. How many people in Guyanese culture know what Nara means? Okay, or what is Nara? Okay? Now, it's about how do you transform and incorporate what our community members already know and take a little bit from what the Western Europeans and Americans are telling us and bring that together. Hang on. There's one other thing that Alicia alluded to. Hang on.
No, just for the sake of our listeners outside of the Caribbean, is there another medical term for Nara?
Not that I am aware of. It may exist, but I just know it as Nara. And you use some warm soft grease in a glass. Okay, and you knight the person belly.
Knight it.
But I just want to go back to something that Alicia was talking about. And it's about people accessing mental health care in Guyana. And about doctors now going into the communities and making themselves available to answer questions or provide referrals. But the question then is, what mechanism is there used to screen people in Guyana? Are they using the PHQ-9, Patient Health Questionnaire 9? Are they using the GAD-7, General Anxiety Disorder 7? Are they using the Hamilton Scale? These are 3 recognized forms of screening. But those 3 screenings are American and Western European and American constructs. Is there a screening that has been devised for use in Guyana within the Guyanese context, understanding Guyanese culture? Do you follow me?
Yeah, the medical term for Nara is bellyache.
Yeah, but bellyache could be any number of things.
Or it could be
That's what it's telling me here.
Yeah, because you're doing a quick Google search, but often what we know that is often somebody might have, when you said Nara, it may easily be mistaken for appendicitis. Because that is often what it is. And sometimes they say, well, I cure Nara, I had to rush it to hospital because the Nara ain't work.
But appendicitis is in the lower side of your body, and Nara
the lower right side.
It's in the belly. So how can it be mistaken?
Could be mistaken, Dr. Rose, because the nature of pain, it travels, right?
And sometimes there's emanating pain. So the pain,
because
yes,
that's where doctors have to do the test. So sometimes there are tests that they put you to lie down and they tap your lower left and they look for a reaction from your stomach, from your abdomen rather, to see if it's appendicitis or if it's just normal belly pain.
I just want to go back to something. So when Bob Marley said that marijuana is a comforter, based on what you said, Colin, then Bob Marley probably was right at that time. Anyway, I want to go to another question here, which is of importance. people with mental health issues are often ostracized, but they also say that suicide, there are many other variables that cause people to commit suicide, like family disagreement. One Indian cannot marry to a certain person. The question is, Indo-Guyanese is about 39% of the population, and 90% of them are committing suicide. That's what the numbers are showing here. They account for 90% of the suicide rate in Guyana. So, but there are a number of other variables outside of mental health that are causing suicide. I was told by a friend of mine of the quarantine that a 15-year-old told his mom that he doesn't want to go to school, and the mother slapped him. And next morning, he was found hanging in his room. Is that a mental health issue? Or he was just believed that he can't get his way, and that's it?
Some suicide are impossible.
I want to suggest that there are a number of different things, and I'm glad that you said that suicide is not a one reaction or one response.
Yeah, there are many variables associated.
There are many factors that contribute to suicide, and there is a progression before someone gets to suicide.
Right.
Okay, there's a progression that builds from stress. Unaddressed stress leads to anxiety. Unaddressed anxiety then leads to depression. And when depression continues to remain unaddressed or unabated or dealt with, then suicidal ideation can step in. And as a matter of fact, it is determined that someone who's experiencing depression or even major depression, which is one other aspect of bipolar, is experiencing the equivalent of someone who has relapsed multiple sclerosis or someone who is quadriplegic, which means they are paralyzed from the neck down, and therefore you have to do everything for them. For a 15-year-old who threatens his mother that I'm gonna kill myself if you send me to school. We have currently that there are some children who threaten to kill themselves if you take away their phone or their electronic device.
Yeah.
Okay, as a form of punishment or some form of corrective. We have to also understand that there are a number of different factors playing into this. One is that we have so sensationalized and glorified death that we talk about death as going to sleep, that we will wake up the next day, that it's a long sleep. So when we see the person in the coffin, oh, how they look so peaceful, like they're sleeping. And so a young person thinking to themselves, I'm gonna kill myself, which means I'll go to sleep and I'm gonna wake up tomorrow. So they threaten to do this thinking that they're gonna wake up tomorrow, not realizing, not knowing that they actually do this act, it is forever, they're done. The second part about that is to understand that for many young people, there is a tendency to think, I will live forever. So I can do nothing. Nothing is going to bother me. I can't do wrong. I will live forever. I have my whole life ahead of me. Because we tell our young people that. You have your whole life ahead of you. And so there is that concept in their minds that I have nothing to worry about. I can go through life, I can do what I want, and I will still survive and I will live. But then there's a third factor, which is many who may be already predisposed to mental illness and predisposed to suicidality. Because without, and I'm going to have to do this, that there is one school of thought about the neurobiological construct surrounding depression and suicidality that suggests that if someone is born with short alleles on the serotonin in their brain, in the neurochemicals in their brain, then they are more predisposed to suicidal ideation, to depression and suicidal ideation and attempts, as opposed to someone who is born with long alleles, who may be able to be a little more resilient and bounce back. So we all experience some form of feeling down, feeling blue. But for some people, it is much more than that. For some people, it is debilitating. But our culture does not allow us to talk about, how do I feel? What is happening for me? Why am I feeling this way? And we are often inequipped with the suitable language to be able to address and speak with someone. I'm paying he no mind, I know what to tell you. I don't know what to tell this boy. So I can just left you alone. I can just put you at the foot of the cross and left you in the hands of Jesus. Because we still think that a religious construct is what is going to save us. Notwithstanding, considering that our ancestors used various types of beliefs and religious practices as a salve to help calm them down, and many of our ancestors did use weed because it was part of the hemp. It's part of the hemp family. So many of them used it, and so many of them used religion and religious beliefs to help calm them down. And so we've grabbed Christianity and said, yes, I'm gonna left you the foot of the cross. I'm gonna put you under the blood of Jesus. And I'm gonna leave him, and let's pray for him. Let's lay hands on him. And sometimes that works by helping to calm the person, but it may be temporary because we still don't have the language and we still don't trust healthcare or mental health care providers sufficiently to go and talk with somebody, because you're going to talk your business with somebody else. You're going to talk your business with a stranger. Does that make sense?
Yeah, it makes sense. Mr. Craigwell, you said you did a lot of workshops in Guyana concerning mental health issues, suicide prevention, and so forth. Why don't you team up with Colin and Miss Solomon and maybe do it again? Might be saving a lot of lives. If one life you can save, that's important.
Here now. Colin and I already had a conversation about
it. We've been having discussions, yeah.
Colin and I have been talking about this, and Alicia and I have been talking about this.
Definitely. Yeah.
I have sent proposals to different entities in Guyana about coming to Guyana to do these workshops. Not one of them has responded to my proposal. And I'm talking proposal with a detailed budget. Not one has responded. And one of the things that I was afraid of, because there is a tendency among Guyanese, is to take your proposal and transform it and give it to their friends and family, so that next thing you know, a watered down version of what you put together is being done. That's history. That's a fact. We know it happens.
Right on.
But I will say to you too, that the motto of my organization, DBGM, which you kept trying to figure out what it is, the organization is DBGM. The motto is, if I can prevent one person from killing themselves, my job is done. Their healing begins. And so when I was in Guyana in 22 and did those workshops, I had people come to me after the workshop. I said, I did not know this. I did not understand it like this. And there were people who were coming and talking about things that they have been dealing with for years. I did one for the police. Did
you receive sponsorship?
No, I paid out of my own pocket.
So now you want somebody to pay for it.
Why not? Pay for my flight, pay for my accommodation, and pay to take me around Guyana. So one of the questions I raised with Colin, and I also raised this with Alicia, when Madia happened in 2022 and 20 children were killed, how did that trauma impact the Maya community? But more importantly, how did that trauma impact the families who now it's coming up 1 year later will now still have to grieve and remember my child is not here.
Okay, y'all stay on after the program. Let's talk about this. See what help we can get on a trip to Guyana.
If I can, if I can just add to what he's saying.
Okay,
I wanted to go back to the fact that we were talking about, you know, spiritualism and that kind of thing. So it's totally dependent.
Before we go there, Colin, let me read this to you. A man who was convicted for physically abusing his wife committed suicide this Monday afternoon, in a cell at the Lethem police station where he was being held.
All right, before Colin jumps in on that, if you think about it, there are two things happening here. One is that there clearly was a mental illness, and two, there's domestic violence. Which comes first? Now, if he kills his wife, and
he didn't kill her. He abused her.
If he beat her, but because we've had recent cases from the Essequibo and somebody in Georgetown, somebody I think in the quarantine recently who killed their spouse and then killed themselves.
There's one in Lethem, I think yesterday.
That is what Dr. Rose is talking about. But I think what we have to understand is that the suicide was always going to happen.
Yep.
The suicide was it was just a matter of when. It was just a matter of, I can't deal with this anymore, and I'll take you out as well as I'll take myself out.
Okay. Colin, you want to weigh in? What you were going to say?
Yeah, I was going to say that, so as with the child who his mother tell him to go to school, and also now looking at the guy who abused his wife and committed suicide, there's a lot of things happening there. So going back to the child, why does the child don't want to go to school? And I think these are some of the processes that.
Well, he said he wants to work.
He wants to work, right? So maybe the school environment, he doesn't find it very safe, attractive, right? Maybe he's being bullied in school, right? Yes. That's another big part of suicide ideation. A lot of kids who get bullied, they get real depressed. They don't feel like they're connected with their friends. They feel left out because they don't have, going to school. You have a Bata Sowaki shoe and this one have a Nike shoe, and then they trouble in them and that kind of thing, right? That's happened in my time when I went to school. Additionally, you've got what about teachers? Our teachers are abusing kids in the school. So is the classroom a welcoming environment? And now the other part is they want to work because obviously now they found that there is an alternative. There's something to get away from going to school, and work might represent that escape, right? And that's all part of the whole mental process. What about at home? Is the environment at home promoting abuse? Is it promoting education? What's happening there? Because we're hearing just the mother is telling them that they have to go to school. And so all of this now is bottled up. You don't want to go to school. You don't want to be abused. You don't by a teacher, your friends, you don't want to be bullied. And so you find that this is your escape route, right? Similarly, I was going to say to what Antoine was talking about Madia, I think the approach with Madia wasn't very good and wasn't very calculated, right? Matter of fact, I want to say the Madia approach was very terrible because in addition, and Craig and I, we spoke about this, in addition to going into Madia and having your best mental experts go in there, you also needed to go in there and have public health practitioners to do surveillance. Because a fire that has destroyed the lives of kids are not an isolated event from the socio-economic, political environment in Madia. And so I myself at that time reached out to the minister, and I did request and I did ask to go into Madia free of cost. I was going to go there by myself on my own volition, and I was told no. So Guyana is like onto a place where people are struggling. You would tend to think that you need all the help that you need. In some places, they'll welcome you with open arms and say, well, come in and help us as much as you can. But no, we don't want it. We want to pick who we want to help us, right? You've got this big container of food and people are hungry, but you say, no, 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 you don't need this food. Something is wrong with a society like that. Matter of fact, I wanted to say on the show that maybe we need to check the mental health of our politicians as well too, because maybe they're affected and their decision making is affected as well. And we need to really consider that as one of the things, because if you don't see inclusion, if you don't see the ability to help others and get the best people in there and get the best and the brightest folks in there to get the job done, then I mean, it's mind-boggling to me.
I just want to add one thing to what you're saying there, Colin, because you are mentioning a number of different things that need to be done. One of the things that I think is crucial and should be an amendment to the recently passed Mental Health Act, right, Alicia, is a confidentiality law to provide privacy and confidentiality in health and mental health care. In 2017, a friend of mine took her life. She drank carbon pills. We did not know that she was the victim of domestic violence. Her partner used to beat her at home, but yet she was a champion and an advocate for domestic violence throughout the Caribbean and Guyana.
Yes.
And she went to the hospital and saw her file on top of a file cabinet in full view of everybody in that office. And she felt betrayed because I read the letter that she left after she had taken her life.
Yeah.
She said, I felt betrayed. I felt I had no privacy.
I know who you're talking to. I worked with them personally as well.
That should have been carelessness on administrators, because there is a privacy clause in the Mental Health Act or in all healthcare acts in Guyana. I can tell you that. So that could be carelessness part of those.
So then it needs to be either revised or it needs to be enforced.
No, the law is there. She should have reported that, and probably action would have taken against those people.
No, but it's the same. No, it's the same. But because her partner was a doctor at the hospital, it's the equivalent of somebody saying my partner or my husband or my wife is a policeman. I am not going to the police station to report a policeman. The police are not going to investigate one of their own.
She would have to report it to a doctor. The administration, she can report that too.
Yeah.
Let me jump because time is running out. Go ahead.
So there are systems so that, and the law do cover confidentiality.
Yes, I know that.
Once it's reported, it is being dealt with. But if persons don't come forward, a lot of times what happens is people have these experience and they're afraid to go forward because they're afraid that they don't get access to the service. When they come back, they feel that they might be victimized. And like in her case, she might say her husband is a doctor. If I go forward, they might tell him that, I came and this is what they say. So sometimes we have to go through the channels and ignore the fact that in our society, in the Guyana society, we tend to think that a lot of times that I am going to be victimized. And because of that, we fail to report things. Even me, sometimes there are things that I witness and then I don't say anything because I know if I say something, it may affect the person or it may affect me in the long run. But we have to, in cases like that where they feel that they're they're being violated, it needs to be reported. So action can be taken so it doesn't happen again. And
So,
I mean, she was going through her own thing, and yes, that was one, but there are other things that would have led to her taking her own life. And there are many cases, but if we don't report these things, we can't take action. We can't know if these laws are being enforced and how effective they've been. So
Mr.
we need to
Cragwell,
report those
Yeah,
things.
I know there's a
but then
Privacy
also,
Act.
Alicia, you have selective prosecutions in Guyana too.
Well, okay,
Well, that's
but that's a different topic. But why I know their Privacy Act is because I got a cousin who works at a private hospital. She's the chief medical officer there, and I was trying to get information on my brother. She said, "You know what? We are cousins. I can't tell you from the hospital. I'll tell you when I get home." So, because of the Privacy Act, it covers not only public but private hospitals as well. So I know that.
So I want to. So even if we have the Privacy Act, Dr. Rose, what is the mechanism of reporting? Because the mechanism of reporting, I don't think could be going to Georgetown Public Hospital or going to a health clinic or saying them, oh, I feel like I've been compromised. Is there a facility? Is there an agency that is tasked with that?
It should be, but you know what? I'll check and
put to the Department of Justice. There is office
and so
I check.
Here is- here is one other thing. There was big fanfare when they started the suicide hotline in Guyana. Who is going to call that suicide hotline and say, I'm thinking of killing myself? Where your name? Where you live? Oh, I know you family. Why we're wrong with you?
Exactly.
I know. Let me get to two questions.
Next thing you know, you left the call center, you gone home, and you gonna tell your mother, your grandmother, you know who calling? So call. Let's say you can kill yourself.
Right.
Okay.
Or look who got AIDS. That used to be our thing.
That was another issue. Yes.
We have 5 minutes, and I have two questions. And one came from my good friend again, Dr. Brown. She says to tell Alicia, who claims to say that there are a lot of agencies and institutions in Ghana to help the mental health. She says, well, if the illness is increasing, it seems to her that it is not working. Yeah, and the psychologist, he said the psychologists need to take a different approach. Now, my question to all of you, Alicia, name me 3 primary reasons, causes for mental health. Just name them. Don't explain. Just name them.
So, some of it could be cultural. I think. Okay.
Cultural. What's the other? Because time is running out on us. Culture.
The political atmosphere in Guyana currently.
What else?
And this whole island gas and persons having to adapt to all of these new changes and new development that we're seeing. We're seeing a lot of things changing rapidly, a lot of systems being implemented. Today you go here, this is there, and then tomorrow when you go back, it disappears. So a lot of changes coming with the island gas sector coming into Guyana. It's causing anxiety for a lot of people.
Colin, name me 3 others, if you know of any 3 others outside of those 3.
Well, it's all social, political, and economical, but I would underscore 3 important ones, which is poverty, I'd say discrimination, human rights, and employment. I think employment is a big one. And
Mr. Cragwell, can you name me 3 outside of those 3?
He called me Mr. Cragwell like I did in front of a judge. Antoine is fine.
Okay.
So the 3 that I would name are neurobiological. I would reinforce cultural. And I would also look at socioeconomic and psychosocial together. I suggest that all 3 of these taken together forms a holistic perspective and an outlook towards providing mental health care for someone, helping them go towards mental wellness.
If I should tell you that mental health is genetic as well, would you believe that?
Yes.
Yeah. Okay, good.
That's why I said neurobiological, because in the neurobiological, there is a component that is inherited.
Okay. I'm glad you all agreed to that. Now, my final question to all of you. Are the governments in the Caribbean, which is slated as mental health is increasing throughout the Caribbean and Guyana, doing enough to stem mental health issues and suicide in those countries, or they should do more? Quickly, who wants to start?
I think they should. I think they should do. I don't think they're doing enough. I think they should be doing a lot more, particularly for the Caribbean, because I referred to Craig Anderson's research on anger, on heat causing anger, rises in anger. And when you look at climate change and the way it's going to affect communities, we're now seeing droughts and fires in Guyana. We see extreme flooding in Brazil, which is likely to come across the Guyana. We see that with rising seas and sea temperature, many of the Caribbean islands may become inundated. So that affects quality of life, food, access to goods and services.
That is climate change because it's happening in Texas too. Colin,
yes, but climate change does actually contribute to mental health destabilization.
Yeah. Okay.
Yes.
So this means that all of us will suffer mental health issues. Colin, what about
eventually,
you?
Yes.
You think the governments are doing enough, Colin, and what they should do more?
No, we're not. So I want to look at our expenditure on healthcare, right? In Guyana, we're now spending almost 11%. We're spending almost 130 billion of the 1.14 trillion dollars. So that's 11%, right? We're spending about $300 million in general training, another 2.2 billion. So 2.5 billion, if you could say, on mental health. That's only about 2%. I believe that we actually need to raise that about 4 or 5%. And I think we need to move mental health away from the Ministry of Health and have it as a separate institution. I called for that at the 2021 Guyana Wellbeing Conference, because it is such of a big deal right now for us and across the Caribbean. And I think even with the Caribbean Public Health Agency, do we have to probably develop a CARICOM or Caribbean mental health center somewhere, or do extensions of them throughout all the islands? But definitely we need to spend more money. We need to develop institutions. And like I said, when I mean institutions, I don't mean buildings, because politicians love to hear buildings, but I mean research, development, training, and resources through financial funding.
Great. What about you, Alicia?
I don't think we're doing enough. And like Colin said, we need more funding. And a lot of times we want to create stuff, but we need to create functioning stuff, things that we know that will help the people and represent the interests of the people that we're trying to serve. So we can create a lot of things, but a lot of times when we create things, it don't function. So we need to ensure that when we create whatever we're creating to assist and to address the needs of people, it is working and working effectively. It is meeting the need, and we take a bottom-up approach rather than a top-down. Right? We talk to the people about what they need, and we address it from there, and taking it from the bottom up. So we build it from the needs of the people rather than we thinking this is what they need and giving it to them. So we need to do more. Governments need to do more in understanding. First, they must understand this problem. It's not in isolation. It's happening to us. And like you said, eventually all of us are going to be affected. But if we take the necessary step, we can get better.
Amen.
Do you know 15 CARICOM states have less than 100 psychologists? I said that in closing. Colin, start with you, your closing remark.
So that is actually very good, because I've also looked up at some of the lowest mental health
what you're saying, 100 psychologists is very good?
No. I said that's a very good point that you're making.
Okay.
Yeah, some of the lowest suicide rates in the world is Antigua, Barbuda, Grenada, St. Vincent, and Venezuela. So in Latin American Caribbean, we have 5 of the lowest suicide rates. I think we need to find out what's going on in those countries as a best practice. So today we've had that discussion about what is mental health. We know that it's just not something that's physically with someone, but it's more internally. And we've also looked at some of the causes. My appeal to the people of Guyana is the way to solve this is a three-pronged approach. Yes, we believe the government has to do more. They have to develop institutions. But at an individual level, I believe that people have to come together as a community. Stigma and discrimination, some of it is propagated by systems in place, but some of it is also us. I think we need to reduce the stigma. We need to say that tonight there's a mom with 4 kids and she's depressed because she can't provide for these kids, but she needs help. So please seek out for that help. Seek it out through your community organization, the National Suicide Helpline, or even talking to a friend. And I think as a people, we have to change this culture of looking at this as something is wrong with you. Nothing is wrong with anyone because this is life. Life happens to everyone, and there is there's millions of people around the world that is suffering from this, and they need help.
Okay, Antoine, you have 30 seconds. Your closing remark.
How you give 45?
It's gonna upset your mental health.
I know. I think Alicia was talking about a bottom-up approach to addressing mental health in Guyana. And Colin was alluding to this as well, about how do we reduce the shame and the stigma surrounding mental health in Guyana. And I think being able to have the language, to be able to encourage people to talk, to open up and not be afraid that they will be judged, that they will be discriminated against, that they and their families will not be held responsible because of how someone is. We've got to begin to start. So even if we get the government, let the government provide the resources, but we've got to develop on the ground, going to the mandirs, going to the masjids, going to the churches, going to the schools, going to the community centers, going where people meet and where people gather, and begin to have conversations so that mental health becomes another form of conversation. It's part of our language.
Okay.
So that people understand that when I am going through something or I see somebody going through something, I know what to do to step in, to help them or get them the help that they need.
Great. Alicia, your closing remarks.
You got 15
30
seconds.
So I would piggyback on both of what Colin and Antoine would have said, but also we have to continue to have these conversations, because one of the things, yes, we can go into the mandirs, the churches, the temples and stuff like that, but we have to not let it be a one-off thing. It has to be continuous, because oftentimes we start these conversations and then we leave the people. And so it has to be continuous. We continue to talk about it. We continue to let them know that it's okay to have days that you don't want to get out of bed. It's okay to have days that you just want to sleep all the time. But if it's continuous, you can come, you can talk with somebody, and making it normal, making them feel comfortable about having these feelings, having these thoughts, and that creating a safe space for them. Because a lot of times, yes, we talk about providing care, but there's no safe space. People oftentimes feel judged, they feel discriminated. And so, yes, we can go to these places and meet them where they are, but then the space is still not safe, because we could say, oh, it stays here, but when we leave, we are not in that community. We leave, it leaves with us, but it's also left with other people. And they would have shared their story, would have made themselves vulnerable. And so we also have to create safe spaces in these environments that we go, and ensure that all people are accountable, that persons are safe. And remember that mental health is all of our business, and there's no health without mental health. You could have all the wealth, you could have everything, but if you don't have a good mental health, it isn't worth it.
Thank you. I want to say it was a very robust discussion tonight on mental health, and I hope all the viewers and all our listeners pay keen attention to what you all have to say, because I learned a lot myself. So I want to say again, thanks to all our listeners and our sponsors. Thanks to Noir Singh for making this program available, Devin Bissoon, Ryan Gobin, our technical directors, and a special thanks to all three of you. I will invite you all to come back at a subsequent time because it's a very important issue. But the next time I'll bring up what I call the societal expert. Why people are committing suicide. Mental health is one of the reasons, but there are a number of other variables he was telling me that people are killing themselves. So at a subsequent time, I'll invite all of you to come back on the program and we'll have a better discussion, more understandable of what the issues are and how we can try to solve them. Tonight we tried to solve them, but it wasn't that wholesome. We have to get deeper into solving these problems because it's really ravaging the country. So again, thanks to all of you and good night.